Hi, welcome to the SMI Fall Forum. I'm Rubin Pillay, and I am the Assistant Dean in the School of Medicine at the University of Alabama at Birmingham. I also hold the position of Chief Innovation Officer of the UAB Health System and am the Executive Director of the Marnix E. Heersink Institute for Biomedical Innovation. The core mission of our institute is to future-proof healthcare. Today, I want to talk to you about the future of healthcare and lessons that we can learn from our quest to make us an interplanetary species. So to start off, I would like to say that we are in a watershed moment in healthcare. Generations to come are going to judge us based on whether we were able to capitalize on the opportunities presented to us, or whether we have succumbed to the challenges that we were not able to capitalize on. The future of healthcare is set to be one of abundance, where if we're able to leverage the technology trajectories and more specifically the convergence thereof, we have the opportunity to make access to care ubiquitous at costs approaching zero. More specifically, the convergence of hardware, software, communications, and biomedical science technologies is going to drive four key vectors that are going to shape the future of healthcare. First, we will see the evolution of patients from passive recipients of care to actual producers of care. And I've coined a term for that called prosumerization of care. Second, we will see care delivery models evolving to a platform-based approach to care delivery. Thirdly, we will see the insurance system being transformed from an insurance-based system where you pay in to mitigate against ill health to a system where you get paid to maintain health. And fourthly, and arguably just as important, is the current technological trajectory will place us on a path to disease elimination. And if that happens, we have to question the business case of our current sick care model. For the purposes of today, I want to focus on the prosumerization of healthcare. And as I've alluded to previously, what I really mean is that we are not currently in a phase in healthcare of consumerism. I go from meeting to meeting, and all I hear about is the importance of the consumerization of healthcare. Well, communication technology has democratized health and market-related information, and that does, in fact, speed the transition towards consumerism in care. But the convergence of technologies now enables patients for the very first time to produce care. So when they start to produce their own care, and there are several examples of this, we actually define them as prosumers and not consumers. You're probably aware of some of the commoditized medical technologies that now drive the prosumerization of healthcare. You can do a 1 or even a 12-lead EKG at home. You can run some of the diagnostic tests using your smartphone. So in effect, the combination of sensor technology, communication technology, and artificial intelligence has empowered patients to deliver healthcare. So what is the impact of the prosumerization of healthcare? Well, I'd like to define these as two key impacts. One, it is going to lead to the dematerialization of hospitals. Current healthcare models are obviously bricks and mortar based and are based on the patient and the consumer model. The future, a dematerialized hospital environment, means that patients will be empowered to deliver a substantial portion of their care at home. This has implications for providers, and this has implications for the supporting network of stakeholders, aka suppliers as well. The second key impact or outcome of prosumerization of care is the deprofessionalization of the medical profession. So, in the event of the dematerialization or dehospitalization of healthcare, what are the implications from a supply chain point of view? A pretty good use case would be to look at space travel and how they have been innovative in trying to redefine the architecture to enable us to become interplanetary species. They're faced with pretty much the same situation that healthcare is faced with now. And I think using NASA and using the space industry as a whole will give us a pretty good insight in terms of how we can map the architecture of a future sustainable and resilient supply chain in the context of prosumerization and dematerialization of healthcare. Some of the examples, and I implore you to take a look at NASA's Gateway Plan, their supply chain strategy aimed at making us an interplanetary species. Some of the key components you will see being part of the plan includes using multimodal strategies. That's absolutely critical in a decentralized, dematerialized hospital environment. Lots of lessons for us to learn from there. Secondly, NASA's very strong focus on creating a local economy in the destination space. We've seen the evolution of space travel over the decades, from a NASA-centric to a Soyuz transition. And now, of course, we see a host of different players now entering the space program. This is by design. This is a risk mitigation strategy to make space travel sustainable and resilient. There is a strong focus on developing local economies in the destination spaces. NASA's quest to figure out whether we can find access to water and whether we can convert this to potable water, to oxygen, and to fuel is aimed at building a local economy. There's also a very, very strong focus on additive manufacturing at destination sites, be they the moon or Mars. Healthcare has somewhat of a head start in the 3D manufacturing process. I think, and as 3D manufacturing becomes commoditized, it offers opportunities for this kind of local economy model based at homes. NASA is also designing an architecture based on a node and arc model. And these nodes and arcs will be populated by humans, robots, and suppliers. Trying to understand how NASA has reconfigured the supply chain architecture in their quest to make us an interplanetary species will give us a pretty good platform to try and design a supply chain architecture for healthcare 3.0, one characterized by a hospital-less healthcare ecosystem. The key question for you to deliberate on is, what does the NASAification of supply chain management be for healthcare?